to everyone. Today we are going to start our first lecture of the forensic medicine. From exam point of view, the topic virginity, pregnancy, delivery, abortion consists of much weightage of the paper. We are going to see first about the virginity, then about pregnancy, then about abortion, delivery. There's nothing such like there are few topics in delivery. We are going to cover that also. First, we are going to talk about virginity. First of all, I would like to clear we are going to follow the book K.S. Narayan Reddy. Narayan Reddy. Now we are going to start our first topic, that's virginity. What does virgin mean? Virginity means a girl who has never experienced never experienced in her life sexual intercourse. A girl who has never experienced sexual intercourse is termed as virginity. Is termed as virgin girl. As there is another termination, there is another term, there is another word that is known as defloration. Defloration means losing of virginity. Losing of virginity means defloration. Defloration. I'm sorry. Defloration. So, what is the medico legal significance of virginity? Why are we studying in this in forensic medicine? Why are we studying this in forensic science? First, the question of virginity arises in cases of first, nullity of marriage. Nullity of marriage, मैरिज को null and void करने के लिए क्या कहते हैं उसके वर्जिनिटी के बेसिस के ऊपर क्या कहते हैं अपन null and void अपन क्रिएट कर सकते हैं null and void क्रिएट कर सकते हैं. First, to check for any sexual offense के लिए अगर अपन को करना. Then for defamation cases for defamation cases also, the virginity could be checked, can be checked, whatever. How we generally determine the virginity is by checking the hymen. What is hymen? Hymen is nothing but a mucosal fold. I'm sorry, it's a mucosal fold. It's a mucosal membrane fold covering the opening of vagina. Hymen is nothing but the mucosal membrane fold which covers the hymen, the opening of the vagina. The length, sorry, the size of the hymen differs age to age. In a girl child, in a girl baby, it is one tip of the finger. Tip of finger. It is larger as size of tip of finger. अपने tip of finger के size के जितना होता है. अब puberty के time पे, puberty के बाद ये वन फिंगर लॉन्ग जितना एक फिंगर जितना बड़ा हो सकता कि एक फिंगर उसमें आराम से चली जाए इतना बड़ा हाइमेन हो जाता है. देन वी हैव टू टॉक अबाउट द hymenal tear. How we are going to determine that girl is virgin or not, girl is is not by talking about hymenal tear. Okay, before that, before hymenal tear, we should study about the types of hymen. हाइमन्स के टाइप्स की बात करते हैं तो काफी सारे टाइप होते हैं, लेकिन अपन को कौन कौन से पढ़ने हैं? ल्यूनेट, we have to study about the semilunar crescentic, annular, cribriform, fimbriate. Sorry, first is semilunar. Semilunar or crescentic. then fimbriate, then annular. Annular means ring like. Septate. Septate means they are like, if I try to draw these things, I'm going to draw in it. So it should be like a half moon shape, like this. This is semilunar or crescentic shape. Fimbriate would be like this, like a ninja star. This would be the fimbriate hymn. Annular, as we can know by the from the name itself, it would be circular. Septate means the hymen hole will be septate. That's it. There will be two hymen. Then cribriform. Cribriform. What is cribriform? Look, like sieve-like openings will be there. What? Sieve-like openings. सीव का मतलब अपन को पता ही है सीव मीन्स छन्नी जिससे अपन आटा छानते हैं चाय छानते हैं सीव लाइक openings will be present and one of the most rarest type of hymen is imperforated hymen. There will be no opening present. There will be no opening in the that layer. There will be this only. That's it. There is nothing else in there. This is the imperforated hymen. This is a medical term, medical complication. We have to do surgery for that. Now we are going to study about the hymen tear. Hymenal tear. How hymen gets tear? By what things? By what procedures? By what activities the hymen could got tear? First, that's most obvious, intercourse, sexual intercourse. Second is masturbation. Third is through any surgical penetration. If any surgery is done, uh, if any surgical procedure has done, by that also. Fourth, by an accident. Through accident also the hymen could get tear. We used to study in NCRT this because of horse riding and because of stretching and because of all of that, the hymen could get tear. No, hymen could not get tear by those things. Hymen could not get tear about those things. Then how we can differentiate? Like how can we differentiate? How can we look if we are looking at the hymen? Then how can we differentiate? Like by which cause, according to these, by which cause the hymen got tear? If hymen got tear due to, if hymen got tear due to, first of all, penile penetration, then there will be hymen tear. Hymen tear will be present if this is your vagina, this is your hymen. Okay? Then there will be tear would be present here. 7 o'clock position, 4 to 7 o'clock position, like this. Tear will be present like this. Tear of hymen at 4 to 6 o'clock, mainly 7 o'clock, but 4 to 6 o'clock position. This is due to penile penetration or due to sexual intercourse. Second, if like masturbation. If a girl is doing masturbation, then her hymen would be tearing at anterior part like this. Anterior part. What is this part? This is posterior lateral part. Posterior lateral part. And this is anterior part. So by just looking at the hymen, by just looking at the hymenal tear, we could tell that the hymen got tear, the deflorination occurs due to this reason. So if we are going to announce a girl virgin or not, how would we do that? So we'll write signs of virginity. We can see we cannot determine the virginity by the hymen itself. Like as we had seen that earlier, because of masturbation also, because of surgical penetration also, because of accident also, the hymen is getting tear. So we cannot say that girl is virgin or not only on the basis of hymen. Yes, hymen plays an important role. The hymen plays an important role in telling the virginity, but it's not the only. So signs of virginity, intact hymen, but it's not. It is not. It is not at all what we can say confirmatory. Okay. Then vaginal mucosal ruggy. Vagina. If this is vagina, there will be rugosity of the muscles of the membrane. There will be the rugosity due to due to friction, due to repeated friction. These rugosity will be lost due to repeated intercourse. It will be only and only lost because of repeated. This word is important. Repeated or multiple intercourse. That would be enough for the today's topic, virginity. I hope you have understood. I hope you have gathered some information, some new information, some brush up of your mind. Thank you very much. That was all about me. Thank you.